Good evening, friends. I'm Dr. Vishal Pathania. I am a practicing ENT surgeon based out of Delhi NCR. My OPD is in Gurgaon, Sector 49. Today, I would like to talk to you about the adenoid and its treatment. Adenoids are nothing but lymphoid tissues which are present at the backside of the nose, in the upper part of the throat. Mostly, they are present in the children, and as the child grows up they regress in size. But in some children the size may be so big that it can cause nasal blockage, snoring, dental problems, hearing loss, ear problems, and ear discharge as well. So if these problems are persistent or recurrent, then it requires a medical attention or surgical attention by the ENT surgeon. Now, if the child is complaining, or you have observed that the child is snoring, is not breathing well, it could also affect the growth of the child, because the growth of the child happens mostly in the sleep time, in the deep sleep. And if the deep sleep is not restorative, the child is not getting the deep sleep, then it can affect the growth as well. For diagnosis of the adenoids, we examine the child in the OPD, and based upon the clinical features may advise an X-ray of the nasopharynx and also sometimes a diagnostic nasal endoscopy. The treatment of adenoids is medical first. First, we use some steroid nasal sprays and nasal decongestants. If we find that the child is not improving, or the problem is getting persistent or recurrent, then we advise an adenoidectomy, which is a daycare procedure or requires one day admission in the hospital. And the surgery is usually done endoscopically and transorally by a microdebrider or a coagulator to hasten the speed and to ensure a complete removal of the adenoid tissues. The recovery time after the surgery is usually 2 to 3 days, and within 2 to 3 days there is a great improvement in the breathing of the child and the sleep quality of the child. Thank you so much.